As I studied medicine, the topic ended up being medicine. And I love being a clinician and taking care of patients, but the object was basically teaching. And I was told by my superiors, in order to be able to teach at a medical school, I would also have to do research. Mm-hmm. And so I developed a research program, and then, but the main goal was always teaching. And one of the things that I think is particularly important is continuing medical education, and particularly in internal medicine, that means having immediate knowledge of what's published in the major journals. And after I moved to Germany, I continued this activities, a weekly journal club. At first I assigned the assistant physicians studies to report, but they were so bad and so lazy that I gave up and decided to do it myself. And I picked two journals because a European journal and an American journal that, in my view, covered the major aspects of what I thought assistant physicians needed to know. And so this began in that I held an hour journal club once a week. Everybody came, and what I did is I told them what was inside the New England Journal and inside the Lancet every week. And when I started, I had to do this actually with a hard copy of the journal and then show the pictures of the studies and the case reports and the reviews for medical education, etc. That's fairly difficult to do in a lecture room with 20 people. But now that I can electronically copy the figures and the major points in the studies and in the case reports, this has become much easier and astoundingly effective in my view. And so in the last 5 or 6 years, I've been able to do this basically via computer, which is much easier than using a hard copy of the journal. And I have a steady clientele of young physicians and older physicians that join in Clinical Journal Club. And since I work at a basic science institute that's filled with very talented people doing bench science that really have not particular widespread knowledge of what clinical medicine is all about, some of them are interested in this, and so I distribute this activity throughout the entire institute as well, the Max-Delbrück Center. So that's why I do it. Fantastic. And the other reason is, of course, is that, if I'm going to consider myself a medical educator, I have to know what's going on, which means that I have to read these journals every week, and I have to understand the articles well enough that I can tell the unanointed what's going on here. And usually the best thing is if you can explain it to someone else, there's the modest chance that you yourself understand.